opening keynote by the Minister for Health at Government of Malta, Honourable Deputy Prime Minister Chris Fearne.
Good morning and welcome to Malta and welcome to MedTech. Thank you for getting up so early. Some of you might have had a busy night. Good. Thank you for coming here. They say necessity is the mother of invention, but necessity is also the mother of opportunity. So in the few minutes that I have here before you, I'll try and tell you what the challenges, the necessities are in the medical field, not just in Malta, but globally, and therefore what the necessities for innovation are, and for MedTech. MedTech, a lot of us in the medical industry in the medical field, look at technology as the knight in shining armor on a white horse that is going to come in and save the day. And really, this is what it is. So what are the challenges and what are the opportunities for innovation and investment that we are facing, the world is facing in the medical field? And before I go into the main challenges, I'll put a caveat. I'm leaving out climate change on purpose, because if I had to include climate change in this and the health effects of climate change, it would take us till this evening. So I'm not mentioning climate change, not because it isn't a big challenge, even in the health sector, but because I want to mention some other things. So climate change apart, I'll be talking about 4 challenges and where the opportunities for innovation, for investment are in the medical field. The first is access to medicines, right? So everybody needs medicines. Medicines make you well. Medicines can cure disease, can control some conditions. But for medicines to work, patients have to take them, and therefore they have to be accessible. So access to medicines is a challenge worldwide, and there's an opportunity there for innovation. The second challenge, which we'll talk about, is the medical or the health workforce. So the demand for services worldwide in Europe and in America is increasing exponentially, and the demand is outstripping the supply of medical people, professionals who are able to give it. So that's the second problem. The third challenge is antimicrobial resistance. You might have heard of this. Antimicrobial resistance is the climate change in the medical world. I'll tell you about this. It's a big problem, existential problem, and we urgently need innovation in this field. And finally, because it's a question of time, because there are so many other challenges, but finally, we'll talk a bit about rare diseases and how innovation can help people with rare diseases. So let's start with access to medicines, right? So everybody needs medicines every now and then, but unless they're available, then there might be the best medicine in the world. Unless it's available to you, then that's no use because it won't cure you. Now, here in Europe, well, everywhere in the world, anybody who takes medicine needs to know what's in it, or at least to know the dosage, whether to take it in the morning, in the evening, before meals, after meals, whether you can take it with another medicine or not, whether there are contraindications, side effects, whether you can take it if you're pregnant, whether you can take it if you've had previous diseases or renal problems, whatever. And to do that, you need to have the information in a language that you can understand, which is why packs have information on the outside, and there's a patient information leaflet inside. Now, the problem is if that information leaflet is in a language you can't understand. Now, fine. Big markets have their own pharmaceutical companies, produce medicines in their language. Here in Europe, we're not allowed to import medicines and to use medicines which have not been approved within the European Union. And since the United Kingdom left the European Union, English has become a minority language. Only Ireland have English as their official language, and then Malta. So small countries with a unique language have a problem in accessing medicines, because we can only get our medicines from Italy in Italian, from France in French, from Germany in German, and that's no use for our patients, because doctors, nurses, pharmacists, and patients need to know what's inside the medicine. So the solution to this are twofold. Either get the manufacturers to print for you specifically in your language, which is costly, and a lot of manufacturers don't want to do it, or else there's something called electronic patient information leaflets, EPIL. So this is a system which we are developing here in Malta, with the European Union Commission and the European Medicines Agency, which will allow us to read the barcodes and scan the barcode, and on your mobile phone, on your smartphone, you get the information in the language that you can understand. So this is electronic patient information leaflets. We're piloting here in Malta. Before this pilot project, it was not allowed to happen within the European Union. So within the European Union, you had to have medicines printed in the language that your patients understand. Now, this is for the first time, electronic patient records are going to be able, electronic patient information leaflets are going to be able to be used within the European Union. So this is a growth area. This is an opportunity for innovation, and this will allow patients in countries with small markets and unique languages to be able to access medicines from anywhere within the European Union. So we can get a pack from Germany in German, scan it, and you'll get all the information that you need in English or in Maltese, which will make it safe, make it cheaper, and make it accessible. So that's one way where technology is coming in. We're using technology to mitigate problems that we are facing in the medical world. So access to medicines is something which is going to grow, because this is going to happen all over the European Union now. There's a lot of interest from everywhere. The pharmaceutical industry want it. The patient organizations at the moment are a bit skeptical, but when they see it, they will accept it. So this is one way where innovation is going to make life so much easier for so many patients. So access to medicines. Secondly, the medical workforce. Never in the history of humanity have there been so many people, so many professionals working in the medical industry. Never. We've never had an absolute number, so many people working as professionals in the medical services. But never has the demand been so large. And the demand for services is outstripping our ability, our capacity to produce and to entice more people to come into the health workforce. In other words, we now have scarcities, and this is all over Europe and in North America, certainly in the global north, scarcities of health workers to provide the services that we can give. One solution which we have been practicing is to bring nurses in and doctors in from middle and low-income countries. It solves our problem, but it creates a bigger problem where they come from. And as President of the World Health Assembly, I'm not sure that I can endorse that. So fine, that's a temporary solution, but it's not the solution globally that we need. So here there is an opportunity for technology to come in and start meeting some of the demand that the health workforce on its own cannot reach. For instance, here in Malta we have electronic patient records which are accessible to the patients on their mobile phone. We have remote patient monitoring, which is allowing our patients to take responsibility of their own care and to look at prevention rather than cure, because you can either increase the supply of your workforce or you can decrease the demand. And by putting in a lot of effort into prevention and giving the citizens, giving the patients the responsibility to look after their own health, we might bring down the demand. And then we have to work more smartly. Artificial intelligence, machine learning can replace people, specialists in radiology, for instance. Now we're seeing very good results with that, with ophthalmology, dermatology. So this is something where technology can help us reach the demand that there is in our societies. And then, of course, there's the telemedicine. Yep, telemedicine came in strongly during COVID. We'll talk about this again when we talk about rare diseases. And we have to make sure that we embed technology into the curricula of our medical schools. We need doctors. Dylan is an example, but Dylan didn't learn this in medical school. He just got this on as he became interested in the subject. But we need our doctors, our nurses, our pharmacists to be experts in technology, because now technology is going to be daily part of what we do. And of course, the use of big data, drones, for instance. We don't have enough pharmacists to open as many, not here in Malta, but globally, to open as many pharmacies as we want in remote areas. So We can have drones to supply the medicines where they need to go, to deliver medicines where they need to go. So there's so much we can do technologically to mitigate the problems of decreasing, relatively, a decreasing workforce relative to the demand. So access to medicines is one field. Medical workforce is another field where medical technology has an extremely important role. The other thing I want to talk about very briefly is antimicrobial resistance. So this is resistance in a bad way. It's resistance of bugs, the enemies of doctors. So it's resistance of bugs to antimicrobials, to antibiotics. So what is happening now is that we are now starting to look at infections which up to a few years ago we could treat with antibiotics, which are now becoming untreatable. Already today, 1 in 5 infections are resistant to the antibiotics that we have. And by 2030, 90% of hospital-acquired bacterial infections will be untreatable, which means we'll probably have to close our hospitals. We're talking 7-10 years down the line. This is an existential threat. We are losing antibiotics much faster than we can produce. The pipeline for producing new antibiotics is almost dry. There's very little investment going there. So we urgently need innovation in this field. We need innovation to produce new diagnostics so that we know what little antibiotics we still have, where to use them properly and how to use them, and not to overuse antibiotics, because that is where resistance comes from. We need to have innovation on surveillance, especially in animals and in the environment, because antimicrobial resistance is not just a human problem, it's also a problem in animal husbandry, in farming, and in the environment. And we definitely need an alternative to antibiotics. We need an alternative to new antibiotics. What this is, I don't know, whether it's bacteriophages, which are the small viruses which actually eat bacteria, yeah? So the enemy of my enemy is my friend in this case, or something new. And this is where technology has to come in. And it has to happen urgently. So there's a very urgent need. The world has a very urgent need for some bright spark to come up with an idea of how to deal with antimicrobial resistance. Malta has just been appointed by the United Nations to co-facilitate a high-level meeting on antimicrobial resistance during next year's United Nations General Assembly. So we are now the focal point for this. We will, within these next 12 months, we'll be working with all stakeholders, including people in this room, if possible, to come up with new ideas of how to deal with this very existential threat that we have before us. So we've talked about access to medicines and the opportunities and the challenges there. We talked about the need for smart working of our health workforce so that we can meet the demands. We've talked about the threat of antimicrobial resistance. And then finally, I'll just take a couple of minutes to talk about rare diseases. So rare diseases are defined if you have 1 case in 2,000 population. Ultra-rare diseases, 1 case in 10,000 of your population. And fine, that's rare. But because there are so many rare diseases, and there are at least 7,000 rare diseases, a lot of people will have a rare disease. It won't be the same rare disease, but a lot of people will have a rare disease. And in fact, about 6% of the population suffer from a rare disease. And the bad news is that over 90%, we think possibly more, over 90% of rare diseases are, as yet, uncurable. There isn't a cure for rare diseases, for most rare diseases, for 9 out of 10 rare diseases. And one of the reasons is that there are so little people with one specific rare disease that it's very difficult to do your clinical research, if you have a potential molecule, to bring it from the lab to the clinic, because you can't do your testing because you don't have a population large enough to be able to do that. So again, there we need innovation. We need, for instance, a platform or platforms which can bring together people with rare diseases from all over the world. So it will allow the pharmaceutical industry to be able to develop meaningful medicines. We need quantum computing, which will allow our researchers to have modeling on how to develop new medicines without actually testing it on patients. It's something that can happen if we have strong enough computers. We now have something called genomics, you know of this. And you've heard of the this new oncotype, the X, which is now available, just come onto the market a few months ago. It's available. It's been put onto the NHS, on the National Health Care Service, without free of charge here in Malta only last week. It's a test, a genetic test, which will allow doctors to know specifically whether a woman with breast cancer will respond to a particular drug or not. Because now, with genomics, practically every disease is becoming a rare disease. It's called personalized medicine. And this is where, again, there is such a big, vast opportunity for improvement. So there's so much that medical technology can do, and there's so much that medical technology needs to do. So we need you to rise to these challenges. So antimicrobial resistance, a big one, rare diseases, access to medicines, the medical health force. And then finally, just to close up, I'll go back to climate change, because climate change is the big elephant in the room. We are the first generation to experience climate change. But we are the last generation who has the opportunity to stop it. Let's not waste this opportunity. Thank you very much. Good morning.